received news that there were reports coming out of China of a cluster of pneumonia cases in Wuhan city.
Chinese officials investigating a viral pneumonia outbreak.
It was linked to this Huanan seafood market, which is a large wholesale market with a lot of animals. It could be just another common virus that commonly causes some of these outbreaks across the world. At the same time, we were on guard as to whether this could be something novel and something serious that we should be concerned about.
A mysterious illness. We will be looking for more information.
I started to see this kind of social media towards late December, reporting of severe pneumonia of unknown cause. And I tried to get some information from my colleagues in Wuhan, and they say, they really don't have no idea at that time, Basically, we will let you know if anything, interesting comes out. For people like us working in the emerging infectious disease outbreaks, it's like a military operation. During peacetime, we train our armies, and during wartime, we just have to go to the battlefield and try to win the war. You don't know when it's going to happen and how severe the event's going to be, so you have to prepare for the worst, basically.
Chinese officials have reported that they're investigating a viral pneumonia outbreak.
A preliminary investigation into a mysterious pneumonia outbreak has been identified as a previously unknown coronavirus.
Coronavirus.
A coronavirus looks like any other virus particle. It is round and it has little spike proteins all around. It makes it as if it's wearing a crown, and that becomes very obvious when you look under the electron microscope. A virus with a crown, hence the name coronavirus.
Early January, we knew it's a novel coronavirus, but we don't know which type.
We are highly dependent on information that came out of China. We had no knowledge, no way to investigate it.
Initially, we were not quite sure if it was spread from animals to humans because of that cluster around the wholesale market, or could it be something that spreads from human to human, which is something that would be more sinister and more of greater concern. That's where you have rapid spread and it results in a pandemic.
I became more worried as the disease went on and the reports of not just a few patients, but hundreds of patients.
It has been confirmed that the virus is contagious from person to person.
It has infected close to 300 people in Asia and killed at least 6 people.
January 20th, I always said that's the dividing line in the COVID-19 pandemic. Beyond any doubt, we have evidence of human-to-human transmission. So for me, that basically changes the whole dynamics of COVID-19.
My first remark was deja vu. It's all coming back again. The hospitals, of the quarantine, of people falling sick, and of course, people dying. I was reliving 2003 and how SARS began.
SARS is a severe acute respiratory syndrome. It took 4 months to figure out what's going on. Just over 8,000 people get infected all over the world, and around 774 lethal cases or death. It's deadly. 1 out of 10 people get infected, unfortunately died. So in terms of the comparison of this novel coronavirus versus the SARS coronavirus 17 years ago, we knew that they entered the human body using similar mechanisms. But in terms of, is it severe? Does it cause the same fatality as SARS? We did not know.
reports were coming out of China that the disease had spread beyond Wuhan city.
Japan has now reported that a patient there has tested positive for the coronavirus.
So Wuhan is quite a big travel hub. If you look at the places that lots of flights go to from Wuhan, Bangkok and Tokyo, which were actually, I think, one of the first to be affected outside of China, and it was clear that the virus would reach Singapore.
I think we all anticipated the first case. It's not a matter of if, but when.
So when we have a new virus, there are actually several things that we need to think about in terms of how we plan out our response to it. So one is, how is it spread?
As more information became available, we quickly realized that this was actually a respiratory disease, which means that it spreads from person to person through droplets.
The virus is carried within droplets emitted from an infected person, such as when a person coughs or sneezes. If these droplets come into contact with the eyes, nose, or mouth of an individual, directly or indirectly through hands that have come into contact with these droplets, the individual may become infected.
Many COVID cases have itchy, sore throat or cough. Certainly, I think most of the cases had fever as well. So we're looking for the sort of combination of fever and pneumonia.
One of the first things that we did was to start temperature screening at the airport as a way of stopping transmission coming into the country.
At the same time, we informed our doctors in Singapore that they should be on the lookout for any individual matching these symptoms and with travel to Wuhan city in China to actually let us know if they have seen any such cases.
However, it sounds like any other cold. How else do you differentiate between a cold virus versus COVID-19, one that possibly kills? The way to do it is you need a differentiating test, you need a diagnostic test. This is how we confirm whether a person has a disease or not.
There are many diagnostic tests you can do for infection, but now what we call the first line responders is always going to be a molecular test. And the scientific name is the polymerase chain reaction, so PCR. So PCR basically is an amplification of a tiny genetic material, which is the virus genetic material. We can amplify it, and then we will know exactly which virus that you have.
In other words, you are actually doing fingerprinting of the virus, very much similar to the DNA fingerprinting, which detectives will go to at the scene of a crime. When you don't have a diagnostic test, you cannot identify, you cannot lock down the enemy, you are on the losing end of the battle.
I was in office actually doing my routine work. And then my boss says we may have Singapore's first case.
It was the laboratory that phoned me and said that they were tracking this particular individual. Soon after, my phone just kept ringing.
I received a call from my colleague for a suspect case. I quickly retrieved the medical records and get a sense of what the case is about. I know that he's a 66-year-old Chinese national that came from Wuhan on the 20th of January. He has fever and cough, and because of his travel history, he was isolated and admitted to SGH isolation ward for further assessment.
We need the National Public Health Lab for confirmation. If confirmed, that should be the first case in Singapore.
And it was going to be a test of the system in Singapore collectively, whether we could deal with this virus and contain it. We tested him and he tested positive for COVID-19. This is the moment of truth where we have to really put all our energies into dealing with a force of nature and to see how we can best deal with it. It was both a sense of relief, but also, I think, a sense of fear, because we were fearful as to what this disease might bring us.
Singapore has recorded its first case of the coronavirus.
He has been isolated and warded in the Singapore General Hospital.
We were very much prepared because we were expecting the first case to come to Singapore, and now we could just get on and deal with the case and to start the contact tracing process. Contact tracing is essentially when we identify a case, an infectious individual, we will try to determine who has been in contact with that individual and therefore might have been exposed to the disease. What we have to do is to find out when the person's symptoms occurred and also where the person has been to. This process is what we call locally activity mapping, where we actually map the person's activities across time. And the number of contacts per individual can be very large, and that also means that every single case has the potential to expose and to spread disease to many people. We would like to get as much information as quickly as possible because every minute that we spend means a minute more that the virus could actually spread or propagate.
The result confirmed is positive. So MOH instructs us to do active mapping contact tracing. We in level 9. The patient were actually in level 8. So we just go down one level, go ward 68, try to talk to patient. Because that's the first time, we do this. Actually, it's something a bit exciting, a bit nervous. Because the patient come from China, and then he has typical flu symptom, so the patient immediately admitted to isolation ward. The isolation ward actually look like a normal ward, but the ward is one patient in one room and with 2 layers of glass windows. I just wave through the glass window, and then the patient also wave back. Patient seems not too bad.
Some people actually may have mild symptoms. However, we knew that many COVID cases could develop rather severe symptoms. So it was something that we were very concerned about.
Each virus attacks a cell differently. It needs an entry protein. In this case, coronavirus have their spike protein, targets the ACE receptor. This receptor is found on the upper respiratory tract as well as the lungs. And with this, the virus plugs into it and through a system of mechanisms opens the port and the virus penetrates into the cell, take over the machinery, and after that blow itself up, releasing lots of new viruses. That alone doesn't kill the patient. the body understands that virus has entered and started mounting an immune response to it. In the right calibrated response, the infected cell gets controlled, gets killed, and all is good. But in the case of COVID-19, many individuals ends up with an inappropriate immune response. Not only is the infected cell destroyed, but the neighboring cells are also destroyed. The immune system has gone berserk. This will now compromise the lungs' capacity to work and the body's capacity to do its function to breathe. People get sick, and despite machine support, the person may still die.
He seems okay, not too sick to talk. I'm originally also from China. We spoke the same language. We try to talk their intercom, but we cannot hear clearly. We watching the time constantly. We still need to collect all this information, send to MOH. MOH side also waiting for information to do their job. I managed to ask patient his phone number, and then he says his son is outside, just next to ANE, waiting for the information of his father. I say, okay, maybe we use Chinese WeChat to do communication. New technology really helps. I spoke to his son around 4:30. I told him I'm from Singapore General Hospital, I'm working. I thought his father got COVID-19, and actually his son provides most information about the patient. After I finish all the information, and then I send to MOH within 2 hours.
I waited for the information to come in, and then I reviewed the activity map. We learned that the patient arrived on the 20th of January. He was having sore throat while on the plane, but there's no fever. He traveled with 9 other family members. After he touched down, he traveled to Shangri-La Hotel. The next day, on the 21st of January, he started to have fever and cough. On the 22nd, he was not well, so he took a taxi to SGH emergency department. This brought a timeline of the patient over the 3 days so that we can find out who have close contact with the case. Speed is important, so the sooner we get the contact's name, information, and contact details, it's faster for us to reach them, and we can inform them of their exposure.
One of the things that we were worried about was how quickly it will spread throughout the population, how transmissible it is. So specifically, if you take one infected person, how many people will they infect before they recover? So we measure the transmissibility through something called the reproduction number. So that gives you a measure of how rapidly the epidemic can spread and whether it can be controlled. So we think about some of the other viruses that we have. What are their reproduction numbers? So seasonal flu probably is around about 1.5. So one person who's infected will infect maybe 1 or 2 other people before they recover. Pandemic flu, if we think back to the worst flu pandemic was 1918, which killed somewhere between 20 and 100 million people. The reproduction number there was something like 2 or 3. So some of the early studies were estimating a reproduction number for the new coronavirus somewhere around about 2 to 3, which would put it on par with the 1918 flu pandemic, which is one of the most severe pandemics that we had seen in history. For the new coronavirus, one of the projections that we look at is what would happen if we did nothing at all to try to prevent the epidemic. So an unchecked epidemic, reproduction number of 2, would probably infect around about 80% of the population over that first wave. And we think, although we're not sure, that it might kill between 30 to 40,000 people in Singapore if we were to let the virus spread completely unchecked.
After I talked to the son, I realized I need some detailed information. Day by day, hour by hour, what the father did. I just called his son again. While speaking to his son, asking his father's information, he told me he may got a dry cough. The two surely got close contact. I realized he may also got problem. I says, you immediately report to emergency department. He was immediately admitted and isolated.
On the 23rd of January, our first case tested positive for novel coronavirus. His son was isolated in hospital for further medical assessment and treatment. However, they were here for a holiday with 8 travel companions, so we needed to locate them urgently.
We need to know where are the other family members. I just pick up phone, call his son again. But he told me that the other family members not in Singapore. Only his son looking after his father. The other family members, they went to Malaysia.
Singapore being a travel hub, it is extremely challenging for us to prevent the spread of COVID-19. We are set up as a global trade and travel hub and as a cosmopolitan city. So because of that, when we have an individual who is infected, his or her contacts may not always only be in Singapore.
Singapore thrives being connected to many cities. We take the trains, we take public transports, you fly where people are all locked up in the tube, sitting close to each other. This is where the virus spreads very well.
So as compared to in the past, where it would take a disease months or even years to circumnavigate the globe, now it can actually go from city to city in a matter of hours. We contacted the Malaysian health authorities to inform them that there were contacts of this case that were in Malaysia. We maintain very close relationships with our counterparts across the region and globally to enable us to have this rapid exchange of information.
I understand that the Malaysian authorities had tracked the family down and tested them, and 3 tested positive and were isolated.
So now our focus was to do the contact tracing on day one for the potential contacts in Singapore. I gathered from the case that he was having sore throat while on the plane, so we'll trace his flight into Singapore.
I learned from his time the airplane seat number, which flight, what time from Wuhan, what time touched Singapore, all this information, quite detailed. Also from WeChat, actually, they take a picture sent to me, the family's air ticket. From the picture, I can copy all the information quite clear, quite fast. After I finish all the information, and then I send to MOH.
The plane that arrived was from China Southern Airlines, airplane number CZ351. With that information, we contacted the airlines to request them to send in their flight manifests. We have prior communication already established. They are kind of used to us requesting for flight manifests.
On the flight, we typically contact trace the people sitting around that individual, typically about 2 rows in front, 2 rows at the back, and also the flight crew that was serving that individual.
From the flight manifest that we gathered, we identify a total about 35 flight contacts. Yeah. There's about 24 that already left Singapore, included 8 family members. For those that is in Singapore, our contact tracer will try to call them to establish and check that they are indeed on board the plane. So it's all hands on deck. If a contact says that they are unwell, we'll find out where's their exact location currently, and then we will refer them to the hospital for further medical assessment. If they are well, we will tell them that they have possible exposure to a confirmed case and would require to place them on quarantine.
The problem with dealing with a completely new virus is that often you don't have much data about the virus. At that time, very little was known about the disease.
Things are happening so fast. The whole team basically moved over onto working on COVID. We are trying to respond in real time in order to provide us the best evidence that we can at that instant in time to help inform the response.
We are all racing around the clock to unravel the genetic code.
There was a lot of rapid changes, different guidelines being brought in to make sure that we're all kept health and safety as we're coming in to do the work. A lot of the effort of the laboratory got pushed to working out what these viruses were. We had to study the genome to find out more about the virus. The genome is the control center of the virus that provides the instruction of how to infect somebody and how the virus behaves within the host. In the past, it would have taken up to a week to generate the full genome of a virus. But with the modern techniques, it can be done within a 24-hour period.
First, we knew that it's actually related to SARS coronavirus. It's like a cousin, basically, all right? Because at the genetic level, they're 80% identical.
In fact, the virus that causes COVID-19 is called SARS coronavirus 2.
SARS-CoV-1, or the SARS in 2003, SARS-CoV-2, COVID-19, both coronaviruses, very different behavior. If you look at the amount of virus that's found in SARS-CoV-1, we'll find about 10,000 copies of virus per sample there is. In the case of SARS-CoV-2, COVID-19, we're not finding 1 million, but we find hundreds of millions or 1 billion copies per sample. We're talking about 1,000 times more viruses per sample compared to SARS-CoV-1. So for the same cough, we're going to spread 1,000 times more viruses, 1,000 times more infectivity, 1,000 times more of spreading out virus.
It was actually quite worrying, and I was actually concerned how the disease might have spread in Singapore.
Life at that time was pretty much normal, and people were still going out and about on their daily lives.
There was a kind of a staggered awareness of how serious this was going to be. So we knew that if a reproduction number for the new coronavirus was 2, then one person infected would infect 2 people on average. So one person infects 2 people, those 2 people infect 4 people, those 4 people infect 8 people, and so on. 20 generations later, you'd be infecting 1 million new people. So it doesn't take long. If you let transmission spread completely unchecked, it would only take less than 6 months for pretty much the whole population of Singapore to become infected.
So it's very important for us to determine any close contacts that the person might have established as quickly as possible for us to curb the spread of disease.
There is some missing information from the activity map which I needed urgently, like how he traveled from the airport to the hotel, who is the driver, and the contact information. So these are information that I want to find out. I contact the son via the phone, but he didn't want to share information because it's very difficult for them to trust that I'm actually from the Ministry of Health. So I decided to do a case interview myself. I visited SGH to interview the case. I went up to the ward, I met the case, and after seeing me in person and my MOH pass, they agreed to share with me their stories. What I gathered from the interview, I know that it was a charter car that ferried the case from the Changi Airport to Shangri-La Hotel on the 20th of January. The son provided the tour agency contact details, and so that we can call the contact person to find out who was the driver that ferried the case to the Shangri-La Hotel. We speak to the driver on the same day. I will ask that during the journey, was there anything unusual, and told him about his possible exposure to a confirmed case. He was okay, and we actually placed him on quarantine.
But there was still quite a lot of work to be done.
It must move efficiently, it must be able to identify cases quickly, and do all contact tracing as quickly as possible. Anyone you do not identify is one person who can continue and perpetuate the epidemic.
I still continuing doing my case interview, gathering all the information that was needed. I want to find out what's exactly happened during the second day that he spent in Singapore. Like, which room was he in? Did he step out of the hotel? Did he meet anyone? So these are information that I want to find out. I gathered from the case that on the 21st of January, the patient was not well. So he mentioned that he just went for his breakfast. And after that, he just stayed around at the lobby and just outside the hotel for a while, like less than 10 minutes, and then he went back to his room. So I transmit the information back to my team in MOH.
We will have to contact trace anyone in the hotel that had spent a prolonged period of time in contact with the individual. For example, the person who checked in the group at the hotel.
Close contacts are people who have close proximity, about 2 meters, and also prolonged duration, about 30 minutes of exposure with a case. We reviewed the list of hotel staff that was sent to us by the hotel management. And we found out that their encounter or their contact with the case was brief, so they are not considered close contacts. However, we do note that there's 2 of the staff who were unwell. One was the cleaner who cleaned the room. And the other one was just passing a thermometer to the case.
For coronavirus, we quickly realized that it spreads from person to person through droplets or through contact with sort of infected surfaces. So that's a fomite. So fomite transmission essentially is transmission when there is contact with infected surfaces in the environment. When you actually use your hands, let's say, to touch a surface that has the virus, then the virus would actually be on the hands, and if you touch your nose or mouth, the virus could then be introduced into the respiratory system and cause disease.
The 2 hotel staff were later referred to hospital for further assessment. Both of them were tested negative.
We had just one missing link.
We know that the case needed medical treatment on the 22nd of January. And we are trying to find out who is the driver who drove the case from hotel to SGH. From the interview, the son looked through his receipt that he had kept and managed to pull out the receipt. But there's no company details. So we called major taxi operators to find out who the driver was.
When you have one individual who, because of their job, has to come into contact with so many people on a daily basis, that one person can lead to super spreading. So super spreading is when many more infections than the typical number happen because of that one case. They also can actually have quite a large impact because it means that you can go from 3 or 4 cases a day and it could shoot up to something like 20 or 30 infections, all from that one person.
When we are unable to identify some of these individuals, they might spread disease without us knowing, until a point in time where we can pick up somewhere some chains of those transmissions. So it was something that we were very concerned about. We worked very closely with the police, the investigators, the Land Transport Authority, and also the taxi companies to try to piece together which taxi did this individual take. You know, there are so many taxis flying around Singapore, so it is quite a challenge both in terms of time and resources.
We managed to locate the driver on the same day. We actually contacted the driver around midnight. He was well. So in this case, the taxi driver is a close contact, but it's not a case. So we did not do a secondary tracing about the contacts of the taxi driver. He was placed on quarantine for 14 days as well. For case 1, a total of 46 people were identified as close contact. Thankfully, only the son and 3 family members tested positive for COVID-19.
Soon after our first case, China had reduced or stopped travel from Wuhan city and subsequently from the rest of China. So we managed to control the spread into the community and keep cases in Singapore at a very low level, January going into February.
Initially, we still believe that majority of the cases are imported because that's, just during Chinese New Year, quite a lot of people come from Wuhan, spend holidays in Singapore.
But we have to always keep our guard up. We can never be complacent.
Breaking news. The Health Ministry has confirmed 2 more cases of the new coronavirus.
We started also recruiting contact tracers from across the healthcare sector, and so that group of contact tracers increased in size to about 200.
Singapore has the ingredients for successful contact tracing. We have the wealth, we have the manpower, we have the knowledge, and of course the experience to do it. And yet we were not good enough for the sneaky COVID-19.
2 more cases of the Wuhan coronavirus have been confirmed here in Singapore, bringing the total number of cases to 7.
This presents an increasing risk to citizens.
The situation is evolving so quickly. The virus is getting stronger, number of infections are likely to rise.
There are many uncertainties. This can get worse than SARS.
There are now more than 118,000 cases in 114 countries, and 4,291 people have lost their lives. COVID-19 can be characterized as a pandemic. We have rang the alarm bell loud and clear.
The number of coronavirus cases in Singapore has now reached 45.
The virus is probably already circulating in our own population. At some point, we will have to reconsider our strategy.
People were hoarding, and panic drove into the hearts of all Singaporeans.
But then we found that what we call is local community transmission.
There were 3 churchgoers infected with COVID-19.
These patients got this virus from nowhere.
There were more and more cases attributed to this cluster.
This led to a leak of cases into the community, spreading to others slowly.
Even in my wildest imagination, I could not have predicted COVID-19 today. We are on the highest alert, right? In a pandemic scenario, anything can happen.